In this podcast episode, Peter Attia sits down with Dr. Paula Amato, a reproductive endocrinologist, to discuss the intricate world of female fertility. The conversation delves into various aspects of reproductive health, the challenges of infertility, the complexities of polycystic ovary syndrome, PCOS, and the in vitro fertilization, IVF process. Dr. Amato begins by explaining the fundamental differences between male and female fertility. Unlike men, who produce sperm continuously throughout their lives, women are born with a finite number of eggs. The peak number of eggs occurs while a female is still in her mother's womb, with approximately 2 million eggs present at birth. By the time a girl reaches puberty, this number drops to around 400,000. This finite supply of eggs means that women must be proactive about their reproductive health, especially as they age. The conversation highlights the importance of understanding one's reproductive health early on. Dr. Amato emphasizes that women should not wait until they are ready to conceive to start monitoring their fertility. Regular menstrual cycles can serve as a marker for overall reproductive health, and any irregularities should prompt further investigation. This proactive approach can help identify potential issues long before a woman decides to start a family, allowing for timely interventions if necessary. As women age, their fertility naturally declines, particularly after the age of 35. Dr. Amato explains that this decline is primarily due to the quality of the eggs, which deteriorates over time. Even if a woman continues to ovulate regularly, the chances of conceiving decrease significantly as the quality of the eggs diminishes. This is a crucial point for women to consider, as it underscores the importance of family planning and the potential need for fertility treatments as they approach their late 30s and early 40s. The discussion also touches on the emotional and psychological aspects of aging and fertility. Many women may feel societal pressure to delay starting a family in favor of career advancement or personal goals. However, Dr. Amato stresses that understanding the biological clock is essential. Women should be aware of their fertility potential and consider options such as egg freezing if they wish to delay childbearing. This awareness can empower women to make informed decisions about their reproductive health. Infertility is defined as the inability to conceive after 1 year of unprotected intercourse for women under 35, and after 6 months for women over 35. Dr. Amato explains that infertility can stem from various factors, including hormonal imbalances, structural issues, and age-related decline in egg quality. It is essential for couples facing infertility to undergo a thorough evaluation to identify the underlying causes. The conversation highlights the importance of addressing male fertility as well. Dr. Amato notes that male factors contribute to infertility in about 1/3 of cases. Semen analysis is a critical step in the evaluation process, as it can reveal issues such as low sperm count or motility. By assessing both partners, healthcare providers can develop a comprehensive treatment plan that addresses the specific needs of the couple. PCOS is a common hormonal disorder affecting approximately 6 to 8% of women of reproductive age. Dr. Amato describes the condition as characterized by irregular menstrual cycles, elevated androgen levels, and often insulin resistance. Women with PCOS may experience symptoms such as acne, excessive hair growth, and weight gain. The condition can complicate fertility, as it often leads to irregular ovulation or anovulation. The discussion emphasizes the importance of early diagnosis and management of PCOS. Women diagnosed with the condition should be counseled on lifestyle modifications, including diet and exercise, which can help manage symptoms and improve fertility. Dr. Amato also discusses the role of medications such as oral contraceptives and insulin-sensitizing agents in treating PCOS and restoring regular ovulation. The IVF process is a complex and multi-step procedure designed to assist couples struggling with infertility. Dr. Amato outlines the key steps involved, starting with ovarian stimulation. This process typically begins with hormonal medications to encourage the ovaries to produce multiple eggs. Monitoring through ultrasounds and blood tests is essential to track the development of the follicles and ensure optimal timing for egg retrieval. Once the eggs are mature, a trigger injection of HCG is administered to induce ovulation. The egg retrieval procedure is performed under sedation, where a needle is guided through the vaginal wall into the ovaries to collect the eggs from the follicles. This minimally invasive procedure allows for the collection of multiple eggs, which can then be fertilized in the laboratory. After egg retrieval, the fertilization process begins. Dr. Amato explains that there are two primary methods of fertilization: conventional IVF and intracytoplasmic sperm injection, ICSI. In conventional IVF, sperm are placed in close proximity to the eggs, allowing for natural fertilization. In cases of male factor infertility, ICSI may be used, where a single sperm is injected directly into an egg. The embryos are then cultured for several days, typically until they reach the blastocyst stage. Dr. Amato notes that not all embryos will survive to this stage, and the success rates can vary based on the woman's age and the quality of the eggs. Genetic testing can also be performed on the embryos to identify any chromosomal abnormalities, which can help guide the selection of the healthiest embryos for transfer. The embryo transfer is a critical step in the IVF process. Dr. Amato describes how the transfer is performed using a thin catheter guided by ultrasound to place the embryo into the uterus. The timing of the transfer is essential, as it must coincide with the optimal window for implantation. Success rates for IVF can vary significantly based on several factors, including the woman's age, the quality of the embryos, and the specific protocols used by the clinic. Dr. Amato explains that younger women tend to have higher success rates, with approximately 70 to 75% of chromosomally normal embryos resulting in pregnancy. However, for women over 40, the success rates drop to around 10 to 20%. This stark contrast highlights the importance of age in fertility treatments. Genetic testing has become an integral part of the IVF process, allowing for the identification of chromosomal abnormalities in embryos. Dr. Amato discusses the benefits of preimplantation genetic testing, PGT, which can help select the healthiest embryos for transfer. This testing can significantly improve the chances of a successful pregnancy and reduce the risk of miscarriage. However, the conversation also addresses the ethical considerations surrounding genetic testing. While it can provide valuable information, there is a risk of discarding embryos that may be viable but do not meet specific genetic criteria. Dr. Amato emphasizes the importance of informed decision-making and patient autonomy in this process, encouraging couples to discuss their options thoroughly with their healthcare providers. Fertility treatment can be an emotionally taxing experience for couples. Dr. Amato acknowledges the psychological toll that infertility can take, including feelings of anxiety, depression, and isolation. It is crucial for couples to have access to mental health support throughout their journey, whether through counseling, support groups, or other resources. The discussion highlights the importance of open communication between partners and the need for a strong support system. Couples should feel empowered to express their feelings and concerns, as navigating the complexities of fertility treatment can be challenging. Dr. Amato encourages individuals to seek help when needed and to prioritize their mental well-being during this process. As the field of reproductive medicine continues to evolve, Dr. Amato shares her insights on promising areas of research. One exciting development is the potential for using medications like rapamycin to extend fertility. While still in the early stages of investigation, this research could lead to new options for women looking to preserve their reproductive potential as they age. Additionally, advancements in genetic testing and embryo culture techniques are expected to improve success rates and outcomes for couples undergoing IVF. The integration of automation and technology in the laboratory may also enhance the efficiency and accuracy of the IVF process, ultimately benefiting patients.